diabetes is pretty widespread, especially among older folks. This age group tends to face a higher risk of complications linked to diabetes, like low blood sugar, kidney issues, and heart disease, compared to younger individuals with the condition. Managing diabetes in older adults can also be quite challenging. Our bodies turn the food we consume into sugar, which we call glucose, to fuel our energy needs. To actually use this glucose for energy, we need insulin, a hormone that helps move glucose into our cells. Diabetes, or diabetes mellitus, is a long-term condition marked by elevated blood sugar levels. This happens because the body either doesn't make enough insulin, doesn't use it effectively, or a combination of both. Absolutely. Diabetes isn't just a concern for those over 60. Type 1 diabetes, which used to be called insulin-dependent or juvenile diabetes, is often found in kids. Type 2 diabetes, once known as non-insulin dependent or adult-onset diabetes, is the most prevalent type and is typically identified in adults over 45. However, we're seeing more younger folks being diagnosed with type 2 diabetes. Then there's gestational diabetes, which only pops up during pregnancy. Type 2 diabetes often links back to an unhealthy lifestyle. Key risk factors include age, being overweight, genetics, and not getting enough exercise. The chances of developing type 2 diabetes tend to rise as people get older. People are particularly at risk for type 2 diabetes if they are over 45 and have high blood pressure, are over 45 and struggle with their weight, are over 45 and have a family history of diabetes, are over 55, have a history of heart issues, have heart disease, have had a blood sugar test that showed higher than normal levels, had high blood sugar during pregnancy, known as gestational diabetes, or have polycystic ovary syndrome and are overweight. As people get older, they experience various changes that can impact how diabetes shows up. These shifts can complicate the process of spotting and managing the condition. Research indicates that over 50% of older adults with diabetes might be unaware that they have it. A key concern for older adults dealing with diabetes is that their symptoms can sometimes be pretty subtle. Unlike younger folks, the classic signs of diabetes, like needing to urinate a lot and feeling really thirsty, might not stand out as much in seniors. Plus, signs of type 2 diabetes, like fatigue and drowsiness, can easily be mistaken for just getting older. This means that many older adults might not even realize they have diabetes until more serious issues show up. On top of that, a lot of older individuals may be managing other health conditions alongside diabetes, which can make treatment trickier. For instance, conditions like high blood pressure or cholesterol issues can worsen common diabetes complications, including kidney damage, vision problems, and circulation issues. Those with diabetes and elevated blood sugar are also at a higher risk for infections compared to people with normal levels. It's also worth noting that some medications, herbal remedies, and supplements can affect blood sugar levels. So it's important for seniors to keep their doctors in the loop about their diabetes when discussing treatments. Cognitive decline can be another hurdle for older patients, making it tougher to stick to diabetes management plans. Older adults often have weaker health overall, which means they're more likely to face diabetes-related complications that are harder to control. Making changes to diet and exercise can also be more challenging for seniors. If we don't keep diabetes in check for older folks, high blood sugar can really mess with a lot of important organs. It can hurt the kidneys, damage arteries, which ups the chances of having a stroke or heart attack, cause issues with eyesight that could lead to blindness, and even result in erectile dysfunction for men. Plus, it can damage nerves, making people more prone to injuries and infections, which could sometimes lead to amputations. Dealing with the complications of diabetes in older adults can be pretty tough. However, by managing blood sugar levels, patients can help lessen the impact of diabetes down the line. It's super important to focus on preventing those long-term complications. When it comes to figuring out diabetes in older adults, there are a few tests that doctors usually go for. 1. Random plasma glucose test. This one can be done anytime during the day. 2. A1C test, also flexible on timing. This test gives a look at your average blood sugar levels over the last 3 months. 3. Fasting plasma glucose test. For this one, the patient needs to skip food for at least 8 hours beforehand. 4. Oral glucose tolerance test. This test starts with an overnight fast, followed by a sugary drink, and then checks blood sugar levels 2 hours later. It's not typically used for diagnosing type 2 diabetes. Managing blood sugar levels for older adults with diabetes can be effectively achieved through a combination of diet and physical activity. In some cases, individuals may also need to take diabetes medications or use insulin, along with treatments for other health issues like high blood pressure or cholesterol. For many, a dual approach of lifestyle changes and medication is essential. Moreover, it's crucial for older adults with diabetes to have regular appointments with healthcare specialists for several important reasons. To conduct blood tests that help determine if their diabetes is well managed. To have routine eye exams that check for any complications related to diabetes. To monitor weight and provide support for weight loss if needed. To regularly check blood pressure and offer treatments for hypertension if it arises. To examine foot health, looking for any signs of ulcers or infections, and manage any foot-related issues. To carry out urine tests to identify potential kidney issues linked to diabetes. To prescribe oral medications or insulin if lifestyle changes alone aren't sufficient for managing diabetes effectively. Managing diabetes in older adults is super important. First off, keep an eye on those blood sugar levels. Both really high, hyperglycemia, and really low, hypoglycemia, can be dangerous. The doctor will set up a schedule for when the patient should get their glucose and A1C tests done. If you're managing diabetes without insulin, you might not need to check your glucose all the time. Next, focus on a balanced diet. What you eat can really impact blood sugar, so it's crucial for seniors with diabetes to stick to healthy foods. Load up on green veggies, cut back on starchy foods, and steer clear of fatty animal products. Opt for healthier plant-based fats like beans and peanuts. Also, try to limit sugary snacks like cakes, candies, and sweet fruits like jackfruit, mangoes, and pineapples. Don't forget about exercise. Regular activities like walking can really help with blood sugar control for seniors with diabetes. Lastly, make sure to take medications as prescribed, even if you're feeling better. It's important to stick to the routine. If there are any side effects, or if taking the medicine is tough, like swallowing issues, definitely talk to the doctor about it. Tips for preventing diabetes complications in older adults. Keep an eye on your blood pressure by checking it regularly. Manage cholesterol levels. Make sure to get a blood test at least once a year to check your cholesterol and fat levels. High numbers can lead to heart issues. Kick the smoking habit. Smoking can raise your chances of facing a lot of health problems, including heart attacks and strokes. Get an eye checkup every year. Spotting and treating eye issues early can help keep your vision sharp. Check kidney function periodically. Diabetes can have an impact on your kidneys, so it's important to monitor them. Maintain oral hygiene. Brush and floss your teeth every day. And visit the dentist twice a year to prevent serious dental issues. Care for your skin. Keep your skin clean and take good care of any minor cuts or bruises to avoid infections. Inspect your feet daily. Make it a habit to check your feet every day. If you notice any sores, blisters, skin breaks, infections, or calluses, consult a doctor right away. To sum it up, diabetes is pretty common among older folks. If it's not addressed quickly, it can lead to some serious health issues. However, the good news is that with the right medical care and some lifestyle changes, those risks can be significantly reduced.